So today I am going to discuss a very important topic with you. Usually people ask why we do nasal surgeries, and we as surgeons we can also ask ourselves why we do the nasal surgeries. What I mean to say is what are the indications for nasal surgeries? There are different nasal surgeries we perform here, starting from simple septoplasty to septorhinoplasty to open rhinoplasties, closed rhinoplasties, and destructive surgery, radical surgery like SMR. So today in this case, this is a young man, about 18 years old patient, but he had a difficulty in breathing with snoring and disturbed sleep. So when we examined, he had some trauma in childhood, and that had made a deformity in the nose. That is a nasal bridge deformity. Second, there is depression at this supratip area. Also, there is a retraction of this columella externally. So these are the visible deformities. You see, if we elevate this tip, we will see the nasal septum. You see the nose, the nasal cavity is divided into two chambers by a midline wall. That is the nasal septum. While the other side of the wall is also further converted into elevations and depressions. So this division of the nasal cavity, single into double, and then the other elevation and depressions, has a specific aim. That aim is to increase the surface area of the mucosa of the this nose. So you see, we as humans and living individuals, we need every second oxygen. We need oxygen every second, and that oxygen is carried to the body through the nose. And just at the mid of the body, that is in the chest, there are a pump is fixed in the form of two balloons on both sides in the chest. These are called lungs. They compress and expand. Thus, during expansion, they inhale the air with the oxygen from the environment, and then that oxygen can be carried to the nose or the mouth. But the nose is the main part that is made for the breathing purpose, while the mouth can be used in emergency, but usually it is not used, especially during sleep. In awake, we can breathe through the mouth if the nose is blocked, but during sleep, the mouth is blocked. So, and the nose is already blocked, but if the mouth is also blocked, then there is loud snoring and disturbance in the sleep, fragmentation of the sleep, that we call obstructive sleep apnea. When this happens, the sleep is insufficient for the individual, and the patient had severe somnolence, daytime sleepiness, decreased effectiveness in the performance, plus there may be some auditory problem, ear problems, as well as behavior problem. The person becomes irritable because of decreased sleep. So in this particular case, in addition to the cosmetic defects, there is this inside wall, that is the nasal septum, is markedly deviated, buckled towards both sides, thus blocking the nose. If you focus on the screen, so you see the screen, nose with endoscope. You see here, this is the right side of the nasal cavity. Both the walls are touching each other. Now give me the curiosity millimeter. This is the part of the nasal septum. This is the part of the nasal septum, this one, that is deviated. And this part is the lateral wall, this. So both the walls are in touch. They are touching each other, in contact with each other. So the right side of the nasal cavity is completely blocked. So this patient cannot breathe through this side. Now come to the left side. If you see here, give me a section please. This minor bleeding is because of the injection of xylocaine 2% with the adrenaline. Give me this one. So if you see the left side of the nose, this side is, you see there is a marked deviation of this medial wall, that is the nasal septum. You see this one? It's like a spur, and this blocks here. So this part of the lateral wall is called the inferior turbinate. This part is the medial part is the nasal septum, that is deviated towards laterally. You see here, this is the left-sided inferior meatus, and both the turbinate and the septum are touching each other. The only way is this one. You see, that is open up to the middle of the nasal cavity. But if you reach the middle of the nasal cavity, there is another bulb, that is the middle turbinate. So up to here, this part is blocked by these two deviations. This is deviation, and this is the inferior turbinate. Up to here, this is open, but still If you go across the midline, at the middle part of the nasal cavity, there is another turbinate that is blocked by this turbinate. So the only very narrow part is left as this part, but this is also very narrow and posteriorly blocked by the posterior part of the middle turbinate. So this means suction marker means in this patient, both sides of the nasal cavity are obstructed completely. You see, the patient cannot breathe through the nose, and he used the mouth, and because of that, the patient's you see the deformity in the teeth. Because if the mouth of a child remains open all the time, so the development of the face and the jaws is deformed. The teeth don't develop in alignment. So the facial appearance as well as the nasal appearance give a bad look to the patient. So now this is an adult patient, and now we are going to fix all these deformities. We have to straighten this nasal the septum. You see here to achieve bilaterally patterned nasal cavities. Plus we have to address also this depression. You see this supratip depression. So let's start. I told you before surgery I showed you the nose. You see there was a marked DNS and retrocolumnar retraction. There was depressed nose. Now I can show you here the nose is elevated. The tip is also elevated, columella is now visible, the ala are now aligned on both sides. Now the shape of this patient is completely changed. Now if you focus on the screen, I will show you the inside of the nasal cavity. You see, so before surgery, I showed you the nose of this patient. Now this is after operation. We opened from here, we elevated this flap and opened the nose. Now, before this surgery, I showed you this right side of the nose. You see, this was completely blocked before surgery. Remove this, yes. But now you see this side is completely patterned now. You see, up to the nasopharynx, we can see the nose. You see, this is the nasopharyngeal area. So this right side is open now. The cartilage that was deviated is straightened and replaced, repositioned. Now this is the other side. The left side of the nose, as you saw before, there was a bulge here. It was a crest which was touching this area. Now this is also removed and repositioned. Now both sides of the nose internally are patterned. So functionally his nose is restored because now he can breathe properly through the nose on both sides. So this was all about this rhinoplasty. So we did both cosmetically as well as functional rhinoplasty. We addressed both the factors. The functional, that was the obstruction in the nose, and the cosmetic, that was deformed nose, was restored. So thank you.
Thank you.
And at the end, I thank all the team of this OT, including the anesthesiologist, the OT attendant, the OT assistant, and the other people, the runners. Thank you, and the cameraman too.
Thank you, sir.
Thank you, sir.